Distinguished speakers and guests in the healthcare and telecommunication industry, my colleagues and members of the Private Hospitals Association of the Philippines,
of the
magandang
private
hapon po
hospitals.
sa inyong lahat. The year 2020 has brought a lot of challenges to everybody, and the hospitals are not an exception. Being in operation 24/7, even during the pandemic, the hospitals required a lot of facilities in order to operate. The lockdown has slowed down much of its functions, but as a hospital, we cannot just stop and wait. We have to find ways and means to communicate with our staff, our doctors, and our patients in order to be able to impart at least the basic or the important aspects of healthcare delivery. This has brought into the forefront the importance of telecommunication, telemedicine in particular, or virtual communication medium. The word tele came from the Greek word tele, meaning far off. Through these virtual methods of interaction, the hospital was able to impart its functions, its different modalities of healthcare delivery, because face-to-face contact or even physically attending or appearing at the hospital has become somewhat forbidden or not allowed unless during an emergency. Interaction, therefore, was made possible through a stable and reliable communication line, wireless communication, and most importantly, the internet. Without the internet and wireless transmission of information, it would have been very impossible to continue the different healthcare delivery methodologies without sacrificing the health of the providers and their patients and exposing a lot to the spread of infection. The wireless communication technology had afforded the transfer and transmission not only of voice, but data that made possible the treatment of a lot of ailments without necessarily exposing people to the dangers of contamination. Telemedicine, which is a remote means of diagnosis and treatment of disease through telecommunication technology, has helped a lot in the control of illnesses and prolonging the life of patients through constant consultation. And this has lowered the morbidity somehow. Although nothing can replace a face-to-face or a hands-on consultation, in the initial stages of the pandemic when we were caught unaware and unprepared, this has helped a lot in ensuring the continuity of treatment, and this has contained momentarily the spread of the disease. Although very limited, telemedicine consultation has at least helped people who cannot afford to go out, like the elderly, the very young, and the debilitated. The lockdown was done primarily to contain the disease, since its spread is made through close or direct contacts with infected persons. So this new technology has done a lot in assuring that the spread of the disease is somewhat or somehow controlled and abated. The healthcare delivery system made extensive use of these technologies and innovations at the start of the pandemic, when there were confusion, uncertainty, and apprehension. People have to communicate but have to keep their distance. Doctors need to see patients but need to be afar or have to be protected with shields or barriers to prevent direct contamination. The Internet of Things, using multiple technologies, has made possible interactions and communication in what was supposed to be a very difficult situation where one needs to communicate but has to be detached or distanced. Right now, there are a lot of changes in the healthcare industry because of innovations which we only previously dreamed of. But now it is already being done and is in existence. Right now we have CCTVs, electronic medical records, digital stethoscopes, artificial intelligence powered applications, making use of wireless technology like Bluetooth, RFID, internet, and many more. We have remote asthma monitors, glucose monitors, ECG being done remotely. In other hospitals, they already use tablets instead of charts. Doctors making rounds using their iPads and tablets, making schedules through SMS and internet, while nurses are following the orders in their stations by remotely controlling the giving of medications and monitoring the patient's vital signs through their monitors. Everything can almost be done remotely. Newborns are fitted with RFID devices that gives an alarm whenever they are removed from the immediate vicinity. Staff can be monitored where they are situated and check number of times they have passed a certain area. There is no more need for biometrics for taking your workplace attendance. One can use the RFID and be noted once you have passed the gates or certain areas of the hospital. We can track movements of anybody using GPS in real time. Indeed, we have come a long way on this new era of telecommunications, and we are quite thankful. In summary, the past year or so gave us the importance of connectivity despite the barriers of distance and remoteness. The existence of telecommunication technology has helped a lot during the lockdown and our continuous search in providing remote or diminished face-to-face contact in order to prevent the disease is really a necessity. And that is where communication entities like PLDT and Smart, with all its innovative technologies, are very much needed so we can continue to fight the new challenges and promote health and well-being of our constituents. This is a challenge to the service providers or telcos to be good, efficient, stable, and reliable because a lot of lives depend on them. Good afternoon, and thank you for patiently listening.